Welcome to Hey Chaplain. My name is Jared Altick, and I'm a chaplain with the police department. Hey Chaplain is the police wellness podcast, and we cover the best topics about career, health, and family so that you can be a healthier officer. If you're new here, you can start right here, or you can go back and listen to any episode. There is so much experience and wisdom that does not naturally filter its way down to every patrolman, and I want to fix that. So from the LAPD to Scotland Yard, the guests on Hey Chaplain give you their hard-earned wisdom so that you don't have to reinvent the wheel. Although we normally focus on interviews with police officers, today we're talking to a medical doctor who is married to a newly retired homicide detective. Her name is Dr. Rodarte, and I wanted to ask her about police officer health. Why did they get sick, and what parts of the job cause it? And more importantly, what can be done about it? Dr. Rodarte has a lot of wisdom and insight, not only as a physician, but also as an LEO wife. Here's Dr. Melody Rodarte. Hello, Dr. Rodarte. How are you today?
I'm good. Thank you for asking, Jared.
I'm glad to get to see you today. How did you get into medicine, and what are your connections to law enforcement?
Well, first off, I want to say thank you so much for allowing me to be on your podcast. I'm excited to share one of my passions, and just love that you have a passion for law enforcement as well in that circle. So I wanted to be a physician since I was 5 years old. It was a passion of mine. I liked to watch how people healed. I wanted to when someone got hurt, I wanted to know how to put them back together. So I feel it was ingrained early to become a healer. And I was very lucky I'll be first generation born here in the States. So it allowed me the ability to then take that pathway and become a physician. So, and then I decided to marry a cop. And that's how I got to know the world of law enforcement. There's no law enforcement in my family, so it was a learning journey for sure. And we've been married for it'll be 26 years next week, and so I've learned a lot. I have a huge passion, and I think I'll even say this in medicine. So I became a primary care physician very early on, and then I've gone on to specialize. I attracted people that worked with my husband because they felt safe that I would understand their roles and what their stress factors would be. So it became a passion of mine to really open my doors for first responders and make sure that I was taking care of them, and I became their provider, their physician.
Wow. I can't help but ask, as a chaplain, I always want to know, when you met your husband, was he already a cop?
He was not already a cop. So
Really?
He was,
Okay.
He was an EMT. We were in college. So funny story, we met in a college group at church. That's how we met each other. We had no clue that our circles entwined so much, but we had never physically met each other. We had mutual friends.
Right.
And so, he was an EMT at the time, and went on to become a cop. So,
Wow.
and I was in college, so I wasn't even a physician yet. It was something I was wanting to do. So
he knew you were heading toward being a doctor, but he did the bait and switch thing on you and became a cop, huh?
Yes.
All right. So you've been able to see him, through your husband, through his entire career, because he's retired now, correct?
Yes, he is. He is
right.
retired. He's been retired for 5 years now.
Wow.
But he did do reserve for the last 5 years, but true. It was his last 11 years were homicide, in the homicide world. So homicide detective. And so it's completely different being reserved. So I say his career was finished 5 years ago with the call schedule.
What kind of insights do you think it gave you being married to a cop?
Incredible insight. Incredible. Because I like to say I knew him so well before law enforcement, and through this journey and how it jaded him for a while and really kind of took away his passion for life, and how I saw his health change as well. So his mental health, his physical health, I had a front row seat to everything that was going on inside of him and with him. And that's our passion, why it's fueled my passion more to be an advocate for our specifically our first responders, our law enforcement agents. Yeah.
I know that you give talks sometimes about law enforcement health. What's one of your key takeaways? Like if someone listens to you give a talk, what should they have walked away with?
To protect their health. And everything is reversible to a point. So my platform really is to, one, encourage them to take care of their health no matter what stage they're at, because I think a lot of them think I'll wait for something to happen to then make changes. And I'm a very preventative physician. So that is a platform, no matter what walk of life you are, is prevention. But with my specifically my law enforcement, I want them to take control as soon as they hear what I have to say and know that we can reverse things and protect things, because they're at a higher risk for all types of comorbidities. So I have a passion for them to start reversing it and preventing disease. I think that's my biggest takeaway, is if I can just ingrain that in them, whether or not they heard anything else, I'm okay with them not hearing anything else, but that their health matters and it's never too late.
When I first became involved with officer wellness as a police chaplain, one of the first things I heard is that cops die young. And I thought, well, is that actually true? And then I got to know hundreds of police officers, and their health was worse than I expected it to be, especially since some of them are health nuts. And so on the average, it was worse than I expected it to be. And then I found out about this study that was done that said that this one group of police officers had a 22-year deficit in their life expectancy compared to the general population. I thought, that can't possibly be right. And so can you shed some light on the research that's out there and what it means and your interpretation of what we know and what we don't know?
Yeah, it's a great topic. And that's what I talk about with my health lectures specifically, because so personally, from me being a physician for over 15 years, I've seen it. Their health they get high blood pressure, high cholesterol. They have heart attacks earlier, heart failure earlier. Firsthand, I've seen this. And I love that the studies coming out are really supporting this as well. And so the CDC, the National Institute of Justice, they've made several meta-analyses that have been helpful, I think, showing the importance of sleep and taking care of yourself and how their life expectancy is changed. Is they'll have diseases like, let's say, 20 years prior to the average American. Because of 9/11 and the effects of what 9/11 did, the studies have become even better. And that's why we see most of the studies coming out in 2011 is because now we have 10 years of data watching what happened post 9/11 with increased cancers, heart attacks, decrease in life expectancy, and really setting forth that we need wellness units to take care of our first responders. And my passion really is our law enforcement, because they don't have a place to go to like firefighters. They don't get to eat together as well and kind of debrief incidences. They're alone in their cop car. They're stationed in different places. And I think that even attributes to them developing diseases and health issues quicker as well. So, and they're exposed to the same things, with the environmental things of coming onto a scene.
Well, let's talk about if these studies are accurate, and first responders generally, but law enforcement specifically, if they have a lower life expectancy, what kind of things are going to contribute to that? What's going to shorten a cop's life expectancy?
So their nutrition, because they're usually one to hurry up and grab something, right? Mm-hmm. And a lot of times, depending on where they are serving, what their community is like, they may or may not be able to go into a restaurant and eat quietly. So it's like they're always stressed. So their nutrition, their sleep, they're always on. Whether or not they're on or not, they're still on. So it's a hyper awareness. They're in a chronic state of hyper awareness, whether they're on the job or not. They're protecting their family, they protect their environment. They're wondering if someone would recognize them outside. And now, so there's that hyper awareness. And so that increases that cortisol and their adrenal stress. So I talk about their stress. So nutrition, stress, hyper awareness, sleep. So that affects their sleep. So I talk about, a lot of times they need to worry about their sleep. And you brought up something initially, even those who take care of themselves, they might work out. They probably work out too hard. They might not take breaks. They might be, as you age, you need to change the way you work out too. And so they still pump iron like they're 20 years old, and so it can lead to injuries. Those I think are the main things is nutrition, sleep, exercise. It changes as they move along in their career. And I like to say, you think the legs of a chair, if they can really keep those sturdy and change with what's needed for their bodies, it's going to help everything else. It's going to keep that chair sturdy.
Yeah, I see a lot of idiosyncratic behaviors with some police officers, and maybe it'd be true of anybody, but I'm watching these cops, and I see some of them that are so fit and healthy, but they abuse tobacco and caffeine like it's going out of style because they're trying
and
to stay
alcohol.
alert. Yes. Well, that's not usually happening right in front of me. Caffeine and tobacco while I'm watching, and then alcohol when I'm not watching. And I can't get over the contrast, the inconsistency there, the incongruity of taking really good care of yourself on one end, working out and that kind of thing, and then doing these other bad behaviors at the same time. And maybe that's just a human thing. I don't know. What do you think as a doctor? I'm sure you see this with every patient.
I do. And it makes a difference. And so I kind of talk about what is aligning, I'll even tell you this. So one of my specialties is weight loss. I'm an obesity medicine specialist. And so I talk about it. Don't say, is it good or bad? Say, is it helping you or is it hindering you? Is it going to help you on your health journey? So when it comes to like their nutrition and their working out and their alcohol or their caffeine, I'm asking, is it ultimately helping you or hindering you in your health journey? Because we have a lot of shame when it comes to good and bad, and I don't want shame to be a part of it. And so if we can take that word out, like bad, this is bad for you, because then when you have it and you enjoy it, I don't want you to have shame. I want you to make that decision is this going to help me or hinder me in my health journey? So whether it's, we talked to, is it too much caffeine? Is it too much working out? Is it coming home and having like one beer? Is it going to really hurt you? No, but a few, or making sure that that's what you're craving to come home and have a beer, because that's what then gets you ready to have a conversation with your wife and kids. Then there's an issue with that. So it's not helping you on your health journey. So that's the conversation I have with any patient, and specifically my law enforcement guys. I want to, and gals, how are you de-stressing? How are you taking care of you? Is it helping you or hindering your health journey?
I also see a lot of fatalism that, well, I've decided to be a cop and this is just part of it. I'm going to live hard and die young, and what can I do? And I don't know how to grab them by the shoulders and shake them and say, "Now, wait a second, future you is going to care about this." But do you have any recommendations on how to combat that attitude?
Yeah, I asked them about, what does your legacy want to look like? Do you want to do things outside of law enforcement? And I got a front seat again to this. Like my husband's family and the men have died already in their 50s. Like he doesn't even know his grandfather. And so one of the things I was like is, we are going to protect your heart, like physically and emotionally. I really felt it to be important to do that and to talk through that. And I talked to just even my other patients, but my law enforcement is, you want to serve your community best. I know that this is your mission and you would do anything. You are the utmost. I will lay down my life for another and protecting my community. But when you finish that career, your legacy can can still live, and you can live that legacy by continuing to serve your community and be there for other law enforcement. Or, I mean, look at us with making a nonprofit, organization. My husband is busier now and making a bigger difference, in my opinion, than when he was a homicide detective. Yeah. I love that you're a chaplain. And I say, we have been given the blessing of blessing others and living a legacy, not just leaving a legacy. So no matter what our job is on a current day, we can make an incredible effect on those around us for generations. So I want them to take care of themselves now, and they can go balls to the wall, if I'm allowed to say that. They're allowed to do that, right now. But I want them to have that energy to do that once they retire too. It's not time to just lay down and die, mission accomplished. Yeah. It's like there's still a bigger mission even after they retire.
Transitioning from one set of missions and purposes to a new set of missions and purposes is an important part of being a human, important part of, growing and maturing, moving from being the one who kicks down the doors to the one who manages and leads those people to, whatever comes beyond that. Yeah, that's a difficult knot to untie. A lot of times we're not sure what the next chapter is going to be. You mentioned your female officers. What health problems are stereotypically a male police officer health problem, and which ones are stereotypically a female police officer problem?
Heart disease, hands down, heart disease.
That's a male.
There are discrepancies on how we see it.
Oh, okay.
If you think about it, so most women, they're not going to present like a male. And with heart disease, like chest pain, they may not have that chest pain radiate down their arm. They just might come fatigued and have high blood pressure for the first time. And so that's a major health discrepancy, is finding heart disease in women, because they're looking for the classic signs. Right. And I'll say in law enforcement, our men, we think a 40-year-old shouldn't have any heart disease. And guess what? They do. They usually have their first heart attack 10 or 15 years earlier than the general public. And so there are health discrepancies there for sure. Cancers. I am more aware of looking for cancers in my law enforcement officers earlier than what I would probably do. I start screening them earlier than the average human, just because of what they are exposed to. Okay. Women, because we are moms, and a majority of them, I worry about their stress and how their hormones are changing and how their sleep deprivation. And so my women officers, I'm even more cognizant of this and really getting to that, being more vocal. I think women on average don't want to take care of themselves as much. And so they always want to put the oxygen mask on everyone else first and forget about themselves. And so I'm very much like, if you're not here, you can't help your family. If you're not here, you can't help your kids. If you're not here, that type of thing. You have to put your health first. Where it's an easier conversation with men, where they start seeing things are wrong and they're like, fix it. How do I fix it? Tell me how to fix it, doc. They'll take that time for themselves to heal a little bit quicker than a female would, because they're thinking of everything else that everyone else they're having to care for.
So heart problems with both, but they present differently.
Mm-hmm.
The
cancer.
The cancers come earlier, okay, and probably different types of cancer.
Yes.
I'm thinking of male versus female.
Right. I mean, still the most common things are heart attacks, and then cancers. We think about, breast cancer and prostate cancers and colon cancer is higher rates of colon cancers. I think it's what they're exposed, the exposures is what we're seeing, and leukemias, lymphomas, the blood type of cancers. So, so heart disease, cancers, I'm going to say mental health. Okay. I see anxiety, depression, PTSD is huge, just takes one incident and it can be, and I know some people say PTSI, and sleep apnea. I totally forgot about sleep apnea. You have these fit men and women, who are law enforcement, and they will have sleep apnea, and it would not be something that we would think of, because it's not like they're overweight and they don't say, hey, I'm snoring and I'm waking up choking, or I'm waking up with a headache. they're just noticing that their blood pressure is higher. They're a little bit more fatigued. Their endurance is less. And we forget to look for sleep apnea or sleep disturbance diagnoses.
Talking about other risk factors, tell me what being in law enforcement does to the immune system.
So when our law enforcement officers have a reduced immune system, the longer that they are at a higher stress level. And there's a lot of documentation on that showing that they're more at risk for infections as well as autoimmune processes. And so that's because of that chronic stress environment. Their adrenal glands are just constantly on. And so that's one of the things I think is really important when they continue to come in and say, whatever my kid or this person has, I'm getting it. I'm chronically getting a cough, a cold, sinusitis, things that we talk about what stress can do, really reducing stress to decrease that effect of their immune system breaking down. Lack of sleep is a big one. When you don't get adequate sleep, your immune system can't function. And when you don't have proper nutrition, you won't have a good immune system either, because that your gut, your microbiome is really relying on the food and nutrition you do as well to help you have a stronger immune system.
And when you say autoimmune disease, what do you mean specifically?
So autoimmune diseases can be connective tissue disorders, lupus, different types of arthritis. So we'll see those types of autoimmune, like skin. A lot of them will start telling me they're having eczema, where they've never had eczema before. So different types of autoimmune conditions can develop. And we see them more often in women at earlier ages, but I'm seeing it in men, more in men. And we usually don't think men get some of these autoimmune conditions, but they're happening when they're in a chronic stress, I would say. One stressful event is not going to usually turn one on, but chronic overstimulation with all the other factors, poor nutrition, poor sleep, is going to definitely potentially lead to an issue.
What effect does childhood trauma have on law enforcement as adults?
Childhood trauma, no matter what job you have, can lead to disease later on in life, where a lot of times it can be uncovered, where the mind has turned it off and they didn't even know it existed, and other things happen, and then flashbacks might come. So for me as primary care, I'm just going to say it in this realm, when I start seeing things where I can't break through and I can't find a real reason to why there is a chronic pain, why is there sleep, why, I have little a spiny sense to say, I'm going to ask this question. You don't have to answer me now, but I want you to think about, have there been events that in your childhood or in your teens that were events that if you could go back, you could change? And it can be physical abuse, emotional abuse. I don't want you to answer me if you don't feel comfortable, but I'm telling you there might be things from childhood that are making things worse now. And if you want to talk to a counselor, if I'm sparking anything, then I have safe places for you to go. I have specific therapists that love law enforcement that can walk you through those stages and see if it's something that's affecting you. Because my fibromyalgia, chronic pain, these are typically, there's something that has happened. And I'll even mention there's an incredible book that's out there that's called The Body Keeps Score. And I will recommend it to some of my patients. And I even tell them, you might not be ready to open that book up. I'm going to encourage you to talk to a therapist, a counselor, a chaplain first. And then if they feel like that's a good book for you to look through, then you have an accountability partner to help you walk through it, because it can be scary uncovering some of these and walking through some of that. Doesn't mean you're going to be through therapy for, need 20 sessions to go through it. It just might be getting to talk to that 5-year-old, 10-year-old, 12-year-old self, that it's not your fault. And this is, and really just unpacking it. And then we're done. The brain is incredible. Yeah. If we could even talk about neuroplasticity. We can open drawers and close them and take those files out and put them in another file cabinet and close it, and it never comes up the same way as it did before, causing blood pressure rise, heart rate, sweating, feel of that impending doom. So that is definitely something I talk about, is we have this neuroplastic brain. You can teach an old dog new tricks until the day you die.
Yeah. The background we come from doesn't determine everything about our future. It's not in full control. And identifying some of those things can actually help it have less control. And that's important. Yeah.
I completely agree with that statement. I completely agree with it. It's what you choose to do with what has happened. So it's not always easy, but we have that choice of healing and taking control over what we might not have had control over earlier.
Let's go back to causes. So we talked about stress. I think we implied obesity and things like that as far as like nutrition. I think that I frequently hear officers complain about shift work, and they'll say, I just know that I can't work that shift and be healthy, but someone has to work that shift. So what kind of factors are you seeing as shift work one of the big ones?
Shift work is a major cause, cofactor in disease progression and disease evolvement. And there are numerous studies showing sleep deprivation and it being an issue. Harvard did an incredible study with over 3,500 law enforcement officers showing what sleep deprivation can do. And their decreased work, there are more incidences of accidents. One of the things I talk about with patients who have shift work issues is at some point, there's going to be a change. You can do shift work for a while and, change that circadian rhythm and you're fine. But at some point you're going to hit a wall and you're not going to be able to do it anymore correctly. Or I like to say is you can do it for a certain decade of life. So I let my 20-year-olds do it. They're usually, they bounce back. But once you hit 30, 35, I'm encouraging a change. And I, as a physician, become a huge advocate where I say, you have certain health conditions now. I will write a letter that states you need to have a change in your work schedule now, because we're starting to see the effects. I know that I get the deer in the headlights. I get the, oh, no, but it's something that is a known, we've studied, we have data, we've seen this. 30 is still very young, but when it comes to shift work and the type of work that law enforcement does, 30 to 35, there's a huge change. And I start becoming a bigger voice for them to protecting their health, because I know that they want to have a long career. And this is one of the ways of keeping them healthy so that they can continue on their journey.
Okay, so let's talk about mitigation. What if your department doesn't have anyone else who can do this? Maybe you got promoted and now you're a supervisor of people on the night shift, and someone has to do this. How do you mitigate? Like if getting out of it's just not an option, how do you mitigate the risks that come with the bad eating, the stress, the working nights? What do you do to mitigate that?
So if they can't change that shift, then they have to be more vigilant about taking care of all the other pillars of their health. So it's having a very set sleep-wake cycle so that they get adequate rest. It's treating the things that they can treat, whether it's blood pressure or sleep apnea or, whatever it is. They have to be more vigilant and say, I'm not going to wait to see if it corrects itself. It's like, no, we're going to treat it now and it still might correct itself. And we can always, if it's medications or whatnot, we can always retract those once things change. It's going to be, no, you have to really figure out your balance. So working out, I encourage breathing. I know some of these wellness units are incredible right now with really teaching law enforcement breathing techniques. And, I'm like, the Navy SEALs do it. If you think that it's, just for yoga girls, you're wrong. Navy SEALs learn how to breathe. I want them to really focus on their pillars if they have to do shift work, because then those are the things they can control, because they can't control their promotion, their job. If it's not something something they can change, they definitely can have control over their sleep, their nutrition, their exercise, their breathing, whether or not they're using other modalities with it being like sauna and, red light therapy, whatever. I'll throw everything at them, acupuncture, but you have to make those other pillars stronger. Those other things matter to keep you going in that type of work.
Yeah, the trick with breathing is to call it tactical breathing.
Tactical.
And then it's okay. That's right. Yeah.
I'm going to write that down. Tactical breathing.
I'm telling you, sometimes it's all about marketing and packaging. That's not original with me. I've seen several chaplains and others that will be like, "Hey, let's do some tactical breathing," and they just do a breathing exercise and teach people how to do that. And that's a good thing. Yeah, lower your blood pressure.
That's awesome.
Calm yourself down.
With my husband retiring, he was finally willing to get the help he needed, because you can't go through 11 years of homicide and not be affected by several cases. Yeah. And I saw
physically and emotionally.
Yeah. And he would not get help until he retired, because he was worried about being labeled broken and not being able to do his passion. He was excellent at his job. I will never, ever say anything different, because I saw what his work led to in some of the cases and what other cops told me, about my husband's work. So I have no question about it. But I will tell you, it took a toll. And it came down to an ultimatum that he was going to retire after 20 years, and he was going to get help if we were going to stay married, because I saw what it was doing to him. And I knew that he wasn't broken. I had referred enough of my other patients to get help. And he did several EMDR sessions. And because of that significant change and him feeling released and him having his life back with just several sessions, we wanted to help others who didn't feel safe with going to their agency. His agency didn't have a wellness unit. His agency had no assistance that he knew of. And so we wanted to then start our nonprofit to help those. They could find us, we could pay for them to get connected to a therapist who has been vetted, and then get the help that they needed where they didn't have to go through their agency, so that they could continue to feel safe in their job. And it's become an incredible passion, because now I have a platform as well to talk about their health, and seeking health as well. So it's not just their mental, it's their physical health too. And they are combined. We are spiritual beings, and our physical and our emotional make up. You can't separate them, And so I love that we have out of this was born the Compassion Alliance, because we want to be there and help other first responders. We've opened it up to all first responders, because we want them to have a safe place where they don't feel alone. They don't feel broken, and they can have help to get them back to the dinner table and a healthy marriage, a healthy relationship, a healthy job, like so many things, a healthy part of their community again.
Dr. Rodarte, thank you so much for talking to me today. I really appreciate you.
I appreciate allowing me to come on and share my passion as a physician, and especially as a wife of a law enforcement. Like it is a passion. So thank you for allowing me to come on.
I am so grateful that Dr. Rodarte was willing to give her time to talk to me today. This is the second interview that I've done with part of the Compassion Alliance team. The previous interview was with John Little, a homicide detective I spoke to in episode 78. If you want to hear the specifics about how Compassion Alliance helps to pair first responders with good, culturally competent counselors, you need to go right now and listen to that episode, number 78, titled, When You're Ready for Help. On the next episode of Hey Chaplain.
But I do think that all of us have the same temptations, which is to not allow our subordinates to make mistakes. And I think that there's a mentality that comes that when we know we can't make a mistake, that we get paralyzed by our inability to make a decision. And I think that's probably the biggest consequence that comes out of that, is that we have leaders who are scared to make decisions because of all of the ramifications that come from that. And so really good leaders, and the leaders that I've worked for, have allowed you to screw up and keep going.
This show is able to keep going thanks to listeners like you. Find out how you can contribute in the notes that accompany each episode. The views expressed here are the personal views of the hosts and our guests and do not necessarily represent the views of any law enforcement agency or its components. Dr. Rodarte is a great doctor, but she's not your doctor. The information presented in this episode, including any statements or opinions expressed by Dr. Rodarte, is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment by a doctor who has actually met you. Always seek the advice of your qualified healthcare provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something you heard on a podcast. Go see your doctor. If you like this episode, please share it with a cop or someone who loves a cop. Thanks for listening to Hey Chaplain, and as always, pray for peace in our city.